as you mentioned, we know that predictors of disease severity and progression in ATTR cardiac amyloidosis are vital in employing early and aggressive management strategies. What is the utility of biomarkers such as NT-proBNP in defining disease progression in ATTR cardiomyopathy?
Yeah, now that we have therapies, it's increasingly important to understand how to measure treatment response, and the other side of that coin would be how to measure disease progression. And so I think that it's probably not a one size fits all. There's certainly, as clinicians, we look at how patients are doing functionally in terms of their exercise capacity and their heart failure symptoms, but to have more quantitative metrics to use across studies, both trials and observational studies, I think is really important. And so one of the things that's being looked at is trends in NT-proBNP, and several groups have looked at this. I'd say the largest observational study is probably what was published from the National Amyloidosis Center in JAC a couple of months ago. And one of the things they looked at was increase in NT-proBNP as being a prognosticator. So if you had an increase in NT-proBNP greater than 30% and a greater than 700 increase in NT-proBNP, that was over 12 months, that was associated with worse outcomes. And so I think that that probably reflects progression of the cardiomyopathy and makes sense that that would be associated with worse outcomes, but that gave us some concrete numbers to think about when measuring NT-proBNP in these patients.
Thank you. So let's go back to that relationship you mentioned before. The trial revealed that there is an early greater increase in TTR associated with a lower risk of cardiovascular hospitalizations and mortality. Could you help us understand this relationship further and its clinical impact?
So I think that observation reflects the mechanism of action of the drug. So by stabilizing the TTR tetramer, we expect that there's less breakdown of the protein, and prealbumin is just another name for TTR transthyretin. And so the exact mechanism, I don't think we have a 100% answer on what's going on, but I think that my general kind of simplistic clinician thinking is that there's less breakdown of the protein. So we'd like to see that there's increases in the prealbumin, and the data from the Tribute trial gave us some numbers to anchor on. And so what they found is at 30, if you look at 30 days after initiating acoramidis, for every 1 milligram per deciliter increase in prealbumin, that was associated with a 4.7% reduction in cardiovascular hospitalization. So I think that that's important data that we can tell our patients, because oftentimes they start any therapy and they want to know, how do I know it's working, and get a little bit more clarity on what they should expect from the treatment effect. And so I think those data that were presented at ISA are interesting and helpful for us as clinicians.